It can feel like a completely different activity to perform rescue on an infant, but essentially, the principles of performing CPR on infants less than a year old are the same as for adults. There are just a few differences, but the differences are significant.
So let's take things in the same order as we did for adult CPR. Right now, we'll talk about the skills for 1 and 2 rescuer infant CPR. But this time, we'll first learn to check for a brachial pulse, followed by infant compressions, and then we'll go on to breaths with the bag mask device. Finally, we'll combine those for practicing 2 rescuer infant CPR.
First, if the cardiac arrest is witnessed, check the infant for a response and breathing. If the infant is unresponsive and not breathing or only gasping, send someone to activate the emergency response system and get an AED. Or leave the infant and do it yourself. However, if the infant collapse was not witnessed and there is no response or breathing, check the brachial pulse immediately. Then, if you don't detect a pulse, perform 2 minutes of compressions and ventilations before activating emergency response.
To check an infant's brachial pulse, first place 2 or 3 fingers on the inside of the upper arm, between the elbow and shoulder. Then, when attempting to feel the pulse, press the index and middle fingers gently on the inside of the upper arm for at least 5 seconds and no more than 10 seconds. If there is no pulse, or if the heart rate is less than 60 beats per minute with signs of poor perfusion despite adequate oxygenation, begin CPR.
To begin CPR, place the tips of your 2 fingers on the sternum or breastbone in the center of the infant's chest, just below the nipple line. But be careful not to press on the bottom of the breastbone. With that correct position, push hard and fast to a depth of at least 1/3 the depth of the chest, or about 1.5 inches or 4 centimeters. Deliver compressions at the rate of 100 to 120 per minute. After each compression, allow the chest to recoil completely.